Hi, I'm Zyhia, and the specific movement we will discuss is flexion and extension of the elbow. The humeral ulnar joint is the primary joint that enables this elbow flexion and extension. The humeral ulnar joint is crucial in biomechanics because it acts as the primary hinge joint in the elbow, providing stability and allowing for smooth flexion and extension movements of the forearm, essentially enabling the hand to be positioned accurately in space for various functions like grasping and manipulating objects. When talking about relevance in sports with the humeral ulnar joint, throwing and overhead movements are a big takeaway. In sports like baseball, tennis, and football, the humeral ulnar joint plays a key role in throwing motions. Whether it's a baseball pitcher, a quarterback throwing a football, or a tennis player serving, the elbow's range of motion and stability are vital for power and precision. Another key topic is force transmission. The elbow joint helps transmit force between the upper arm and the forearm. This is essential for effective power transfers in sports involving pushing, pulling, or lifting. Hello. I'm going to perform the incorrect and correct demonstration of elbow flexion and extension. First, I'm going to do the correct way of elbow flexion and extension. Extension, flexion. One more time. Extension, flexion. Now I'll perform the incorrect way. Extension, flexion. Extension, flexion. I am now going to hit on the anatomical landmarks of the humeral ulnar joint. The landmarks are the trochlea on the distal humerus, that is part of the humerus bone, and the trochlear notch on the proximal ulna. This is part of the ulna bone. These are the two primary surfaces that articulate to form this joint. Next, I'm going to talk about the muscles that are involved in elbow flexion and extension. These muscles include the biceps brachii, brachioradialis, and the brachialis muscles. These flex the elbow, and the tricep muscle extends the elbow. Lastly, I will talk about the ligaments that are involved in elbow flexion and extension. We've got the medial collateral ligament, the lateral collateral ligament, the annular ligament, and the quadrate ligament. The medial collateral ligament connects the ulna to the humerus on the inside of the elbow. The lateral collateral ligament connects the radius to the humerus on the outside of the elbow. The annular ligament forms a ring around the head of the radius bone, holding it into place against the ulna. Finally, the quadrate ligament connects the radius to the ulna.
Hey, I'm Zyhia Johnson. I'm a senior at LaGrange College who plays basketball. The movement we chose was elbow extension and flexion. They are essential movements in biomechanics. They are efficient for upper limb function and daily activities such as lifting, pushing, throwing, critical activities like carrying the groceries, opening the doors. When it comes to sports like shooting a basketball or throwing a baseball. The elbow joint is a hinge joint. It allows movement in one primary plane similar to the door hinge. It enables the flexion by bending the arm and extension, straightening the arm while providing stability. The planes in the axis of movement. The movement occurs in the sagittal plane, which divides the body into the left and the right axis. The motion around is the medial lateral axis, which runs horizontal from one side of the body to the other. The forces that act on the joint during the elbow extension is compression forces. They occur at the joint surfaces, especially during like weight bearing or like gripping objects. Tension forces is developed in the muscles in the tension, particularly in the biceps and the triceps. The shear forces may be present if improper mechanics lead to excessive stress on the joint, potentially increasing the risk for an injury. The muscle contractions and joint stability. The contractions during the extensions, such as the biceps brachii or brachialis or brachioradialis, they contract to shorten and pull the forearm forward. During the extension, the triceps brachii contracts to strengthen the arm. As the elbow extends from a flex position, the biceps control the movement, lengthening under tension, and during the controlled flexion, the triceps lengthen. The joint stability, the ligaments, they contribute to stability, preventing excessive movement, and those ligaments are the lunar collateral ligament. If this is too much movement, it can cause a dislocation or a strain. Common mistakes is like when you do it over and over, it's uncontrolled. It can lead to stress on the joint. The way to correct this is having proper technique and just slowing down to help reduce the risk of an injury. Also, when you're lifting or weight training, using excessive weight like biceps or curls, it can lead to a joint strain. The way you can fix this is maintaining proper joint alignment, using controlled movement, which helps prevent unnecessary stress. And I will show you the extension and the flexion. However, this is elbow extension. It opens and is opening the joint, and the joint angle is larger. And this is flexion, which closes the joint, and the joint angle is smaller.
A real-world scenario that we can relate this back to is baseball pitching. In baseball, the throwing motion, particularly pitching, places a significant amount of stress on the elbow joint, including the humeral ulnar joint. The biomechanics of this joint during a pitch are crucial for both performance and injury prevention. Let's understand the biomechanics. When a pitcher throws, they engage in a complex of kinetic chains that involve the shoulder, elbow, and wrist. The humeral ulnar joint is primarily involved with elbow flexion and extension during the motion. Here's the breakdown. First, the initial cocking phase of the pitch motion, which is flexion. The pitcher starts with their elbow flexed to a significant degree. The humeral ulnar joint allows for bending motion of the elbow. The second phase is the acceleration phase, which is extension. As the pitcher accelerates their arm forward to release the ball, the elbow rapidly extends. This involves a controlled motion of the humeral ulnar joint, where the ulnar relieves to the humerus. The third phase is the follow-through, which is flexion again. After the release, the elbow must decelerate, and the humeral ulnar joint goes through flexion again. This phase is vital for reducing stress on the elbow and shoulder and ensuring that the pitcher does not sustain injury from the rapid motion. Performance improvement is one of the big key things when preventing injury in this joint. The proper mechanics in flexion and extension of the humeral ulnar joint allow the pitcher to generate more velocity and control during the pitch. An efficient amount ensures that the force is effectively transferred from the lower body through the core to the upper extremity, with the elbow playing a crucial role in smooth arm acceleration. If the biomechanics of the humeral ulnar joint are optimized, the pitcher can maintain better command over that pitch, improving their accuracy and reducing the risk of over-rotation or unwanted arm movements that could result in wild throws or decreased speed. Some of the overuse injuries of these ligaments, these joints, are UCL, which is the ulnar collateral ligament, tears, or a tennis elbow. And these are just common in pitchers due to the repetitive stress on the humeral ulnar joint. By understanding the biomechanics, such as maintaining proper elbow alignment and not overstretching during the pitch, a pitcher can reduce the strain on the ligaments and muscles around the elbow. Pitchers should also know when to rest, how to warm up, how to stretch, and these are crucial in injury prevention.